Oh my God. Okay. I love the enthusiasm. Hey guys, all good to get started? Okay. Well, welcome everybody to our FURst Aid presentation. The FURst Aid series is a series put on by the college where we cover various topics that are helpful, hopefully to kind of the general public and pet owners, and offers a little bit of insight into some specific disease processes. And so tonight we are going to be talking about urinary obstructions, specifically in our pet small ruminants, so goats and sheep more specifically. And we'll see what clickers going to work here. There we go. Okay, before we get too deep into things, just want to make sure everybody recognizes I don't have any conflicts of interest. Anything that you might see, brand names, photos of things, I have no financial or personal interest in any of them. They're just examples. There are a decent number of personal photos and videos amongst the presentation tonight. Those are shared with permissions. And then there are going to be some surgical photos included, so please be advised if you don't feel like that's of interest to you. Be ready to look away, I suppose. They're not awful, but be advised. So just as a brief introduction, my name is Kelsey Jurek. I am the Assistant Clinical Professor of Large Animal Emergency here at Oregon State University, Carlson College of Vet Med. I've been here since 2023. Specialty-wise or specialty training-wise, I am the diplomat of the American College of Veterinary Surgeons, specifically large animal surgeon. And prior to coming here to Oregon State, I actually went from one OSU to the other. So I was at Oklahoma State for a number of years before Oregon State. It's where I did my large animal surgery residency. I also completed a Master of Science in Veterinary Biomedical Sciences while I was there. And then I was their large animal clinician prior to starting here at Oregon State. And I got my DVM from the University of Minnesota. I put that in there so that nobody has to ask where the accent is from. That is my home area, Twin Cities. So just kind of an overview of the topic tonight. We're going to define urolithiasis and go through kind of the types of uroliths that we see in our small ruminant patients, how they develop and the predisposing factors. We'll go through some of the clinical signs and briefly the treatment options. I'm not going to teach you how to do all of the things. Most of them are surgical in nature, but we'll go through them just so you have an understanding of the options that we have in order to address this problem. We'll briefly go through kind of general prognosis, certainly depending on kind of treatment options as well. And then the meat of this and why it's at the end, because I want it to be fresh in the brain cells, is prevention. And what do we do to keep them from doing this? Because this is one of my most favorite topics and least favorite topics at the same time. Most favorite because this is one of the things that as an emergency clinician I see most frequently. Least favorite because I would like to not see them ever again. So it's a very complicated disease process, and hopefully we can give you some tips and tricks and some information to help maybe change some management and prevent this from happening to anybody in your own herds. So just kind of starting off, we've got different stone types that we'll see. And again, we're in the urinary system, so this doesn't necessarily apply to stone types that we see in the GI tract or elsewhere. But for the urinary system, and in particular with small ruminants, we see two main types of stones. So we've got a phosphatic type of stone, which is going to include a few different types of kind of compositions, or struvite stones, AMCP or amorphous magnesium calcium phosphorus stones, and then apatite stones as well. And then calcium carbonate is the other more frequent type of stone composition that we're going to see. So those are the two main ones, and I'll refer back to those two categories fairly frequently, just based on the frequency that we see those specific stone types. There are a few others. The silicate stones in particular, we do sometimes see those in the western part of the United States here, and we've got people joining us from all over the place. That's one that we tend to see kind of the west side here with the silicate levels in our sand and soils. And then calcium oxalate is another one that we'll see every once in a while as well. Again, there are some regional differences, but above and beyond anything else, we'll see the phosphatic and the calcium carbonate stones. So again, kind of breaking those two categories down, I've got picture examples here. You notice that the calcium carbonate stones look like tiny BBs, okay? They feel like tiny BBs. So they are hard as rock. You cannot crush them. You cannot dissolve them in acidic urine or acidic solutions. They're usually immovable, meaning that they're sizable enough that when they get stuck in the urethra of the goat or the sheep, they don't budge very easily. Sometimes we can get the urethra to relax and allow them to move, and that would be kind of part of what we talk about with our treatment plan. But they're not readily movable, unfortunately. They're also not laser resistant, so that's a common strategy in humans that they'll take laser or lithotripsy to those stones. These stones will not break down with lasers or shockwave or anything of that nature. On the other hand, our phosphatic type of stones, these are more like grit. So they've got kind of a sandy texture. They're a little bit more easily movable, a little bit easier to break down. And these stones do dissolve in acidic solutions or in acidic urine. So both of these stone types form in alkaline urine. And we'll talk about kind of some of the dietary stuff with that. But briefly, they form in alkaline urine, which is what our herbivores on a diet of plant material are going to produce. They're going to produce alkaline urine because that's what that diet favors. With the phosphatic stones, we've got some ways we can manipulate the urine to make it more acidic and to redissolve those stones. Great. Guess which type of stone most of our pet ruminants get? Yeah. Okay. The one that is not so easy to deal with. So that's a bummer, makes us very sad, and makes the conversation a little bit different when we get presented with some of these cases. So the stone type does tend to or can have a pretty significant effect on the types of conversations that we have with owners when these animals present to us for this problem. So here's one of the big main predisposing factors is the male anatomy. Similar anatomy between goats and sheep, so I'm not trying to forget our sheep friends, but it's going to look the same internally, okay? And so we've got a few different things with the male anatomy specifically that make them predisposed to getting obstructive urolithiasis. So not just urolithiasis where they make the stones in the bladder and they end up in the urinary system, but actually having those stones travel out of the bladder and down the urethra. And then anatomically, we've got a few key players here. So we've got this urethral diverticulum. We've got a sigmoid flexure, which is a little curlicue S shape in the urethra. It makes a really tight bend, and it also narrows at that spot as well, the urethra does. And then at the very end of the glans penis, which is the part that exteriorizes, we've got what's called a urethral process. If anybody's heard of the slang term, the pizzle, this is what the pizzle is. Okay, so you might hear that term as well. It's essentially a little kind of worm-looking piece of tissue that extends out from the urethra. We don't have a great understanding of its functionality. We'll kind of get into one of the ways we can address that. But those three things, those three components are why the male small ruminant is so predisposed to getting these stones stuck and therefore not being able to urinate, okay? I point out the urethral diverticulum because that little piece of anatomy is the reason why we cannot pass a catheter from the outside, from the tip of the penis. We cannot pass a catheter all the way to the bladder, and it's because that diverticulum exists. So unless we've got really specialized cameras and specialized catheters, or we make a surgical approach that's just a straight shot instead of from the end of the glans penis, that diverticulum prevents us from being able to pass something all the way to the bladder, to lavage, to try and get a stone to move, etc. And so that's not necessarily a spot where stones get stuck, but it's a piece of their anatomy that makes addressing this issue complicated. So here's a little close-up of that urethral process, and this goat actually has a stone. Hopefully you can kind of appreciate, it's big enough you can appreciate. There is a stone that you can see sitting in that urethral process, kind of through that transparent tissue. And so this is one of the most common spots where we're going to see stones get stuck. And then of course, they lodge in these spots, either in the sigmoid flexure in this urethral process, and the urine can't get past it. We start getting the bladder that gets quite full, and it becomes a pretty serious medical emergency pretty quick. So I'll stop for just a second because I'm going to pick on the boys a lot. And so I just want to point out, can does and ewes make stones? Can the girls make stones? Yes, they sure can. Do they typically, now, never say never, never say always, but do they typically get obstructed with stones? No. No. Okay. Reason being, their anatomy is much more favorable to just passing the stones out into the environment. So we often don't even recognize, they can make them, but they often pass them before we recognize that they're even a problem. Okay, so the girls have their own sets of problems, but this is not one that we tend to see very frequently. Again, not to say that it can't ever happen, but they don't tend to become obstructed. So they'll still make them, it's just not a problem for them. Other predisposing risk factors, we're going to go into these in a little bit more detail when we talk about preventative measures as well. But the really, really big one here, other than just being a male small ruminant, is diet. So we see obstructive urolithiasis in animals that are fed any amount of grain or pelleted diets. We see it in animals that are fed alfalfa or legumes. So peanut hay would count into that, alfalfa, clover. And then this doesn't apply to everybody, but in the state of Oregon at least, a lot of people get their goats for the control of blackberry plants. Guess what can cause urolithiasis in goats? Blackberry plants. So the mineral composition of those plants favors the formation of stones in the urinary tract, and that's the one that I think a lot of people are surprised about, at least in our neck of the woods, because oftentimes people will get these pet goats for control. If you're not familiar and you're joining us from elsewhere, we've got blackberry plants rampant. They're everywhere. They're wild all over the place. You can't stop them. And so that is one control method that is very commonly utilized here, and unfortunately means that we've got a pretty high caseload of urolithiasis here. The urine pH, I kind of already pointed out, the most common stone types, they form an alkaline urine. That's influenced by the potassium content of the forages that they eat. So just forage in general, hays in general, have potassium content that keeps their urine alkaline. And that alkaline urine predisposes them to the kind of organization of the stone components. So they all start out as tiny little minerals, tiny little, organic matter, and they get attracted to each other and form these stones in that alkaline urine. The use of the animal is also a known predisposing risk. So animals that are used for breeding, show, or market tend to have diets that favor stone development, particularly phosphatic stones as well. The one thing we can't say for certain that one use of an animal is significantly statistically associated with the development of a certain type of stone, except for if the small ruminant is a pet. So if the owner has come to you and stated, I have this animal as a pet, this is my friend, that is significantly associated with formation of calcium carbonate stones, which is a bummer. But we do have that information. Water intake and lack thereof is a predisposing risk. So animals that aren't consuming water as readily as others will have kind of super saturation of these crystalloids that then precipitate or organize into the stones. And then a couple of things that we can't really do anything about. We do know that there's a genetic predisposition. Sheep less so, or at least it's not commonly talked about. Certain breeds aren't commonly talked about. It's more diet related for them. But for the goats, the Nigerian dwarfs, the pygmies, and the Boer goats have all been cited as being overrepresented in the population. We do also know that individual animals will have increased susceptibility to forming uroliths. And so sometimes it's the genetic of the individual animal that is a problem, that they just happen to be really good stone formers. And then age, of course, these stones can occur at any age. Calcium carbonate is associated with an increasing age, but the cutoff in this study, or the difference rather, was 4 months. So if they were over 4 to 8 months old, they were at a higher risk of developing a calcium carbonate stone. So it's not like 8 years. It's still a fairly young age, so really can occur in any age of animal. So briefly, the clinical signs, the most common complaint that we hear from owners when they call and say something's wrong with their goat, the most common complaint is that they look like they're constipated, okay? That they are straining, they are vocalizing, they're posturing like this goat here, and are agitated. The tail could be held up. Oftentimes the rectum's protruding because they're pushing, right? They're constantly kind of pushing and straining to try and urinate, and it gives a little bit of a false sense of they can't pass feces, okay? And so that, honestly, if we get a call for a male goat that's constipated, we know almost immediately it's not constipated, it's blocked, okay? Teeth grinding, again, lots of different pain markers. With the teeth grinding, they'll isolate themselves, they'll go off feed. With the phosphatic type of stones that are kind of sandy, sometimes you can feel grit at the end of the prepuce or in the preputial hairs. One sign we really don't want to see is if they develop a really large plaque of swelling either near their prepuce, between their hind legs, along their ventral abdomen, their stomach. That is oftentimes associated with a urethral rupture, where the stone is actually either necrosed through that spot in the urethra, so it's made a weak spot and the urine has started to leak out of the urethra into the subcutaneous tissue, or the animal has been pushing and straining enough that the urethra spontaneously ruptures. And that's not a great deal, and it does significantly affect their kind of prognosis and what we can do for those animals. And so certainly that sort of combination of signs is pretty critical to address. So I put this here, I know I've said it, several of my colleagues have said it, every sick male goat or sheep that is blocked until proven otherwise, okay? That's just how common we see this issue, unfortunately, in these guys. So in regards to diagnosing it, you've got a concern that your animal might not be able to urinate, it's blocked. You bring it to your veterinarian. What we're going to end up doing is looking at blood work, looking at diagnostic imaging, and certainly part of our physical exam is going to be looking for some specific things. So often these animals have a really high heart rate, and that's secondary to the pain response they're feeling. If you do a digital rectal exam, we can often feel a urethral pulse. The urethra is kind of right up against the rectum in that spot, and we can feel the urethra actually physically trying its hardest to push urine down and out because the bladder is too full. The blood work, these cases, especially cases that have been going on for a significant enough period of time, we sometimes see cases that present after 6 to 8 hours, and maybe those guys don't have as severe of abnormalities, but sometimes we'll have people or animals rather that kind of thwart the eyes of their people, and we can see some really severe electrolyte and kidney enzyme abnormalities on blood work, even to the point of being life-threatening electrolyte abnormalities within, even that 12 to 24 hour period is a really big deal. So that's why these are medical emergencies. They need to be seen ASAP, and it mostly has to do with the blood work changes that occur secondary to them not being able to pass urine, along with the potential for rupturing either of the urethra or of the urinary bladder itself if it gets too distended. So on ultrasound, the image in the bottom right hand corner here is an ultrasound of a blocked goat that has distended. We'll see this distended brown bladder. They should be kind of ovoid. Oftentimes we can't find them on ultrasound if the animal is normal, because they won't maintain this much liquid in their bladder normally. This is a really, really overly full bladder. And so we'll see that. We can oftentimes see a distended urethra on the ultrasound, and then we'll usually take radiographs. And the thing about radiographs is that there are certain types of stones that are not radiopaque, and there are certain types of stones that are radiopaque, but by the time we take radiographs with enough kind of juice, if you will, to actually see through the animal, we've burnt out or we've hidden the stones that are there. And so the calcium carbonate stones, thankfully, have more of a metal opacity on radiographs. So hopefully everybody can appreciate the two radiographs here. You can see, and I'm sure that Zoom, I apologize that you can't see my mouse, but this upper right corner, we've got just a whole string. This is just a whole string of individual little BBs of calcium carbonate stones. You can actually see they follow the curve of where that sigmoid flexure is. So you can see them kind of starting to take that turn and they stop. And so just kind of proof that they're stuck at that sigmoid flexure. This other radiograph, a little bit to the left, you see this one singular stone, and in this region, like where the anatomy is here, their prepucial opening is right here, a little bit further to the right in that image, but the glans penis sits a little bit further back into the prepuce, and so this stone likely is stuck in the urethral process at the very end of the penis. And so when we see them along the ventral abdomen like that, that's kind of what we start thinking about. Again, kind of going back to some stones you can see on radiographs, some of them you can't. It can make making treatment recommendations a little bit difficult. Certainly having that information is helpful. At our institution, we do a lot of CT scans on these animals when that modality is available to use. For us here, it costs about the same as doing radiographs, and we do that for educational purposes. So our students and our residents and fellows can get the experience reading more small ruminant studies. And so we are very fortunate that we have the opportunity to CT a lot of these animals. And so that can help us make some determining plans or determine treatment plans when we might suspect that there are still stones in a certain spot, but they are hard or unable to be seen on the radiographs themselves. So we'll kind of go through again the various treatment options that we might suggest doing, depending on, there's lots of different factors that go into this decision-making process. There are some treatment options that are more favorable than others. So here's kind of where we start seeing some more of the surgical images. I put this photo here just because I do have people ask me, this is the one and only case that I resolved using shockwave therapy. This was an intact male goat that had a weird amorphous type of stone. And so it was not a calcium carbonate stone, but we were having trouble getting him to pass that stone. We had acidified his urine, and this happened to work for this creature, but it is definitely a little bit more of a singular success case. It wouldn't be something that I would consider to be likely to be successful in a lot of cases, but it happened to work in this one goat. It's a lot more commonly utilized in human medicine because the stone types in humans are much more responsive to being broken down by these shock waves. So it's just kind of an interesting side case. So conservative or medical management, sometimes we can medically manage these guys primarily, depending on the stone type. Oftentimes we're combining this medical management with a surgical treatment option to address stones that, in particular, those calcium carbonate stones that aren't going to dissolve in acidified urine. So we'll oftentimes need to start these animals on fluid therapy to correct the electrolyte and the kidney abnormalities. We'll oftentimes do also what's called a cystocentesis. So that's where the animal is sedated and we actually place a needle into the bladder through the skin sterilely and drain the bladder of all of its urine. And in doing so, what we're trying to do is buy a little bit more time to do the rest of our diagnostics, start to work on getting the blood work normalized, and prevent rupture of the bladder, having sat there and been distended for potentially a long period of time. One conservative treatment option that we sometimes can utilize is urinary acidification. Again, phosphatic stones can dissolve in acidified urine. Calcium carbonate stones will not. And so using urinary acidification alone is more done as a preventative measure. We'll go into that in a little bit, but it can work for certain stone types. And we might try or be more inclined to try urine acidification in cases that wouldn't have a surgical option otherwise, but might respond to acidification of the urine. So we can give a certain type of salt, it's called ammonium chloride, we can give that orally. We can also infuse various solutions into the bladder in the same process as we were doing the cystostasis. Walpole's is just an example of one of those solutions. That's a veterinarian performed procedure, of course, but it is an option for certain stone types. Now, it is not the option that has a super high success rate. And one of the things that we need to be careful of is that overusing ammonium chloride can actually make the entire animal acidic. So we do have limitations to what we can try and do systemically to make the urine more acidic. In combination with some of those things, we're certainly going to be utilizing pain management. We utilize drugs that cause smooth muscle relaxation to try and get the urethra to stop spasming, and hopefully if it relaxes, it might allow for whatever is stuck to move through a little bit more easily. Plus or minus antimicrobials, that is only in the case where it's justified, i.e. the animal has to have a surgical procedure or something of that nature. And then it is described to do what we call retrograde hydropulsion, where a catheter is inserted from the end of the penis towards the bladder. Again, I pointed out that anatomy where that urethral diverticulum doesn't allow us to pass a catheter all the way into the bladder. So we can't do that, but what we can try and do is in specific cases, again, phosphatic stones are a little bit more kind of that gritty, sandy material, a little bit more likely to move, is we'll pass that catheter gently and then just really gently infuse some saline into the urethra and see if we can't get that stone to push back into the bladder. Now, the issue with trying this is that you are really, really high risk for urethral or bladder rupture if you're too aggressive. So doing this hydropulsion where we try and kind of push the stones backwards certainly comes with a potential cost, and it also doesn't address the stones that are in the bladder themselves. So it's kind of one method to try and get them the urethra patent again, but we still oftentimes have to follow up with some other way to address the fact that there's more stones in there. So oftentimes one of the first things that we're going to do is cut off that urethral process. So that little pizzle at the very end of the penis, it can sometimes immediately resolve the obstruction. And so we can have stones that have just kind of stuck into that urethral process. And if we cut that off and those stones come with it, then the animal is able to urinate from there. Again, oftentimes they have more stones, not just the ones that are stuck. And so it does not address the remaining stones in the bladder. And we can see these animals be at high risk for reobstruction. The thing to point out here, it's not been definitively proven with controlled studies, but we do not expect this to affect the reproductive capabilities of our intact males. So if we've got a breeding ram or a breeding buck that is experiencing this problem, we don't expect that they would not be able to breed in the future by performing the urethral process amputation alone. Kind of next up, and this is the step between just doing the urethral process amputation and actually taking them fully to surgery, is doing what we call percutaneous tube cystoscopy. So we've got these commercial units. These are actually all breeded for humans that we utilize in these species. And it allows for diversion of the urine without, again, taking them to general anesthesia surgery. A couple of limitations, doesn't, again, address the stones remaining in the bladder. Those stones may or may not evacuate through the tube. Oftentimes these percutaneous tubes are really small diameter, And so they're not necessarily set up to be able to have the stones come out through them. The stones would get stuck in those tubes as well, or at least not readily pass into those tubes. These tend to be really short term, so they displace from the bladder really easily because we don't have a way, we're just putting them, we're suturing them or securing them to the skin, but we don't have a way to secure the tube into the bladder itself. And so oftentimes, once the bladder has drained, that tube can eventually make its way out of the bladder, and so it's no longer really diverting the urine anywhere. We don't often see too many issues with that happening because the bladder kind of closes itself over again. This isn't a big hole, and so the bladder, the inflammation of the bladder kind of closes that hole fairly quickly. But it does present a problem in the longevity of doing it this way. This can be really helpful if we get an animal that we have to divert their urine because their blood work is severe enough that taking them to surgery immediately would cause a lot of problems with anesthesia. That could be one of our main limiting factors to being able to address this. So this is a really good option for either being able to medically manage them for a short period of time and get them stabilized, or if they don't have a surgical option, it at least gives us a little bit of time to try and implement all of those other strategies to decrease the urethral spasming, to offer pain management, anti-inflammatories, and those sorts of things. This tube cystostomy, this is considered our gold standard surgical treatment or treatment in general for obstructive urolithiasis. So I've got a little star next to it. This surgical procedure, it's fully under general anesthesia. It's not a particularly complicated procedure. Essentially what we're going to do is exteriorize. We're going to make a little incision in the abdomen. We're going to exteriorize and bring the bladder up to the body wall. And it allows us to make a little incision in the bladder and actually take all the urine out, lavage the bladder. Then we go in there with a sterile spoon and we scoop out all of the rocks that we can find. Okay, that's kind of a fun part of the procedure. We try and get every little stone that we can, and then we're going to place a tube into the bladder to allow for urine diversion while the urethra heals and while we're working on relaxing the urethra and getting any other stones that might be in the urethra and blocking urine flow, getting those out. This tube tends to be a little bit more stable. It can still displace from the bladder, but a little bit more stable because we're actually securing the tube with the balloon and with sutures into the bladder itself. So we're making the catheter a little bit more secure by securing it in the bladder and to the skin. This is considered the best option for restoring normal urinary function. It is one of the only options for maintaining breathing ability. As soon as we do any surgical procedures on the urethra themselves, our ability to maintain breathing function diminishes, and it's because the urethra will often stricture down, and we need a completely intact urethra for those males to be able to do their job in regards to breathing. So it's also the best option for those animals as well. Unfortunately, in being the best option is also the most expensive option. So it tends to be quite costly, and it's typically because it involves a pretty extended hospitalization period afterwards. What we end up having to do is monitor the animal. We give a number of days for there to be kind of a fibrous ring that forms between the bladder and the wall, the body wall, and can kind of secure it and decrease our risk of having urine when the tube is pulled. Evacuate out into the abdomen. We want to try and avoid that. And so it involves the animal being hospitalized and going through all the medical management. And then after a certain number of days, typically 5 to 7 days, depending on the animal, we'll start clamping that tube and letting their bladder fill and seeing if they can urinate on their own. And if they can, great, we start challenging for longer periods of time, and eventually we pull that tube. But oftentimes we'll challenge them and they'll go back to straining and prove to us that they're not quite ready to be able to urinate on their own. And then we have to open that tube. And so it's a matter of clamping and unclamping, clamping and unclamping that tube until we can get them to actually be able to reestablish urination on their own. One of the things that we sometimes have to do in conjunction with this procedure is do a urethrotomy. So that's actually where we incise down onto the stone itself and physically take it out of the urethra and then close the urethra afterwards. And we sometimes are left with no choice but to do this if that stone is large enough that even with all of our relaxants and our anti-inflammatories and our pain meds and not having urine pushing against it, even with all of those strategies, that stone's just not going to budge. And so sometimes we do end up having to take them back to surgery and actually cut the stone out directly. Bladder marsupialization, now we're kind of getting into procedures where they've got a little bit poor prognosis, they're not as ideal to perform, but can be options depending on the case. This procedure prevents reobstruction. Essentially what we're doing is we're taking the bladder. You can see in the photo here, this is not my photo, I pillaged this one, but you can see they've made an incision on one side of the abdomen and the prepuce or the penis is right kind of in the middle. And then on the other side of it, you can see this stoma. And so what's happened is we've made another little shorter incision and taken the bladder and actually tacked the bladder. We've opened it up and tacked it to the skin. So this is just a hole straight into the bladder. And what's going to happen there is now that urine is going to constantly just passively drain. So the animal's not going to get reobstructed through its urethra. The urine's just, it's going to come straight out. So there's no need for the urethra to have to work. But there is potential for this stoma to close over time. There's potential for the bladder, the mucosa inside the bladder to prolapse out of that hole. So we do sometimes have to make revisions. But really the main issue with this procedure is that these animals will get really, really significant skin scald from the urine. So urine and skin does not mix long term. We can also see ascending infections. The fact that the bladder is just kind of open to the world, we can see infections there. These are very high maintenance animals or become very high maintenance animals because owners have to be really, really diligent about multiple times a day cleaning, applying ointments and skin protectants around the stoma. And ultimately, long term, regardless of how diligent somebody is with taking care of these animals, oftentimes far enough down the road, we do kind of get to the point where the animal's quality of life becomes a concern because the urine scald just becomes such a big deal to have to try and manage. And so again, a procedure that we can do. This is often a procedure we don't reach for or perform unless the tube cystostomy has failed, either failed the first time we try it or an animal that has reobstructed 3-4 times. We get to the point where doing a tube cystostomy is just not something that is recommended doing any longer, and so then we end up having to consider these sorts of procedures. Along the same lines, we can also make what's called a perineal urethrostomy, and so that's where we actually take the urethra in between their hind legs. So you can see again, this is another kind of stolen image, but this goat has had a PU done. So this is a male goat, but he's had the urethra taken from right underneath his tail, kind of along the pelvic rim here, and that urethra has been tacked to the skin. So now he's just got a little slit where he urinates out his back legs like a female would instead of all the way down into his prepuce under his belly as he normally would function. This is often a procedure we end up having to use if the urethra is already ruptured. So if we've got an animal where that urethra is ruptured, even doing a tube cystostomy is not likely going to be able to make that urethra patent again because of all the scarring that's going to occur secondary to that rupture. So we're often faced with this as kind of a last resort. The animals might have a little bit more voluntary control over urination with this because they still have the muscles within the bladder to be able to help control things. But we do consider this in general to be a salvage procedure. So certainly there are some cases that have gone on and done okay for longer term, but studies have shown that anywhere from 45 to 78% of these cases, that hole in the urethra will stricture down or close within 8 months. So oftentimes we're having to come back and redo this procedure multiple times if it's a pet animal, or more commonly, we're using this procedure more as what we would term a salvage procedure. Oftentimes, maybe to get a market animal through its market or through its show. Fair animals sometimes end up in this situation, and I don't mean to be rude or crass or anything, certainly, but it is one of those where it tends to be something that we're just trying to get the animal a little bit further down the road, but long term, this is not something that tends to work out as well for us. So quickly, lots of varying prognoses for these procedures. The tube cystostomy, we've got published success rates anywhere from about 50% up to about 90%. Tube displacement is a problem with these. Reobstruction down the road is a problem. The bladder marsupialization tends to have good short-term success, but again, quality of life concerns long-term. So those animals eventually develop urine scald that gets unmanageable. And we have to end up having different conversations. And then the perineal urethrostomy, again, I kind of put that 45 to 78% stricture within 8 months. So typically reserved for animals needing more of a short-term fix. So prevention. This is really the part that drives me to talk about this topic, because I do think, again, this is not a simple disease with one simple solution. So that's the bummer part about it. But oftentimes, the majority of the cases, at least, that get presented to veterinarians for this problem, oftentimes there's been a breach in at least one of these preventative measures. And so I recognize it does sometimes take the fun out of managing them. I recognize that it sometimes does make it a little bit higher maintenance to manage them. But if we're really, really strict about following a lot of these preventative measures, we do see that it does make a difference in preventing animals from developing stones and becoming obstructed. So in regards to the anatomic factors, remember, intact males can still obstruct, but more commonly the castrated males, because they are castrated typically very early in life for our small ruminants. They don't have the same hormonal feedback as they develop, and so they often have a smaller urethral diameter or lumen, so the urethra itself is a bit smaller. And then they also don't develop as strong of what we call the tunica albuginea, which is essentially the fibrous layer that surrounds the urethra. And so if we delay castration, and ideally, most will recommend kind of past the 4 to 6 month mark, we may increase the urethral diameter of those animals, but we also will hopefully create a little bit of a stronger tunica albuginea, so potentially maybe less likely to rupture the urethra in those cases that do obstruct. The intact males, again, still obstruct. They tend to rupture their bladder instead of the urethra, and it's because they have that stronger tunica albuginea, and so the bladder and the urethra. The bladder will give out first as the kind of less strong tissue. Amputating the urethral process, some people have done this as a preventative measure. It's really challenging in prepubescent or really young animals. Again, no effect on fertility is expected in those cases. Usually not done preventatively, but it could be. And some people, I've met a handful of animals where it's been done preventatively. The urine pH, most commonly, we're using this ammonium chloride salt, and we are giving this to them in what we term a pulse dosing. So one example might be that they get it for 3 days on, they get it for 4 days off. Essentially what we're trying to do is we're trying to titrate the individual animal's urine pH down to 6 to 6.5. If we do the pulse dosing, what we're doing is we're keeping the kidneys from kind of learning or becoming able to prevent the acidification, because the kidneys learn the salt essentially. And so we're trying to avoid that by giving them and then taking it away. But what we also need to consider is that overdosing this can acidify the whole animal, which is obviously not something we want to do. And so work with your vet on dosing. There's a general range of 50 to 200 milligrams per kilogram per day. Again, I really want to counsel people, don't just go giving this willy-nilly. This needs a conversation with your vet to determine what other predisposing factors your animals might have, and to make the potential for ammonium chloride decide if it's a sound recommendation, preventative recommendation for your individual animals or for your herd. But this is something that we can kind of easily get over the counter. And again, it's just a salt, it's not a medication. And oftentimes what I'll tell people to do is just get, go to the local, pool shop or online, and get pH strips that you might use to test pool water. Is a really simple way of doing that. And then, you can monitor your animal's urine pH. You have to get a little messy, I apologize for that, but it can be done. Where you use those strips to kind of know what general range. And so sometimes we'll dose them with the ammonium chloride until we get them down into that range, and then we'll stop and we'll watch the pH and we'll dose them just based off of what their urine pH is. And that can be a good way to try and decrease the urine pH, at least for long enough periods of time that any stones that are starting to precipitate would redissolve. Water intake is a big deal, and diet, and I've got multiple stars. This is the one that we see the most commonly in regards to kind of breaches in preventative measures. So clean, palpable, temperature appropriate water available at all times. We know that animals in colder climates will drink more warm water, or temperate water. Increasing forage and grazing. This requires increased water intake for chewing and for digestive purposes. Animals that are fed on a pelleted diet or a grain diet don't have to consume as much water in order to digest that feed. And so when we're seeing that water intake decrease overall, we're seeing them urinate less frequently. When we can get them to urinate more frequently, it helps clear those stone components out of their urinary tract. And so can we help them get rid of the little crystals before they actually form into stones by increasing the water consumption? So encouraging water intake is great. Again, diet, this is the big one. So reduce or eliminate all grains and concentrates. This includes treats for the pet goats. That is the one that, oh no, he doesn't get anything, he doesn't get anything. Well, except for a handful of horse treats a day. That will do it, that is enough, okay? And so no treats of the grain variety, concentrates, like I said, pelleted diets, grass hay only. So again, the alfalfa and the legume hays are really high in calcium. Ideally in their diet, we want a ratio of calcium to phosphorus of 2 to 1. This is something that you can work with your veterinarian on to determine kind of what they're getting, and you can analyze hay and you can balance all these things out. Extension agencies are great for working on this sort of thing to develop an appropriate ratio. Offering adequate trace minerals will help maintain mineral balance and vitamin A levels for mucosal health. One of the things that we can see is if their mucosal health is poor, that includes the bladder mucosa, they can have sloughing of that bladder mucosa that then gives them kind of an organic nidus to form stones around. And so that can propagate the stone formation if their bladder health itself is not very good. And so having those trace minerals and ensuring consumption of it, again, working with your veterinarian, is really important. Remember that these should be species specific. So things that are given to goats and sheep should not be labeled for cattle or for horses, certainly. Those mineral balances are absolutely inappropriate for the small ruminant friends. And then at the herd level, the dietary cation anion difference, we want to work on that being 0. This is getting into a little bit more kind of tricky analysis stuff. Again, working with an extension agent or your veterinarian on getting that DCAD down to 0 can be really helpful at the herd level for larger productions or larger herds to be able to help kind of combat the alkaline urine problem that is predisposing for the stones. So all of these little dietary things on the screen, you've got lovely grain and that looks just delicious and I'm sure has molasses and is super yummy. And the alfalfa in the middle there is just beautiful and is lovely green and grassy. And again, for my Pacific Northwest folks, the blackberry bush is abundant. No, and no. Okay. That will make a huge difference in these cases and helping prevent these cases. Again, you can follow diet to a T and they can still make them. There's lots of other factors, right? But this is a big one, and so just say no. It's a boring grass only life for the male goats and sheep are floral. Again, genetic factors, so considering the animal's breed and familial history. I mentioned this before, but there is individual susceptibility that we can't prevent, unfortunately. So if you know your animal has made stones before, they may or are certainly at risk for making stones again. And so being really, really diligent about managing all of the things that we can manage in order to prevent these stones from forming, it is really, really prudent in those animals that have some of these factors that we can't control. Okay. And then I don't have any personal affiliation with the Minnesota Urology Center, other than having gone to school there. I hold the faculty that run this lab in really, really high regard. It's a great group of people. But this is an internationally renowned lab that offers free analysis of urinary stones. So in cases that are treated for those stones, we, at least at this institution, we send all of them over to the Minnesota Urology Center and get actually the stone composition. It helps to increase the amount of data that they have for their database, but it also helps us tailor recommendations to specific stone types based on what we know might be predisposing factors for that specific stone. So this is a really cool kind of collaboration at the veterinary level that we utilize very frequently in our relationships here. So just take home points, again, not a simple disease with a simple solution. This is a really common emergency in male sheep and goats. Don't be fooled by the constipation clinical picture, okay? If your goat or sheep looks constipated and they're a boy, they're blocked until proven otherwise. If they're a girl right around labor, they're having trouble unless proven otherwise, especially across the species that we've been talking about all night. The preventative strategies diet is a really, really big one, increasing water intake, considering castrating a little bit later in life. Remember, intact males can be affected too, but certainly waiting until they're 4 to 6 months old takes out several of our more commonly utilized castration procedures, like banding and that sort of thing that are still used, pretty routinely. And that's not to say that those aren't necessarily good procedures to be using, but certainly if we're going to wait to castrate them until after this 4 to 6 month time frame, now we're considering actually have to perform a proper castration procedure with anesthesia and oftentimes with a scrotal ablation, those sorts of things. So it certainly makes the castration process a little bit more complicated than if we're doing it when they're real young. But it may help us in regards to preventing some of these issues. And then the ammonium chloride, utilizing the pulse dosing, working with your veterinarian. This is a very simple thing to add to your routine that can hopefully help. Again, it's not something to be doing willy-nilly. It absolutely can have consequences if overdone. But certainly can be a really good arsenal in regards to preventative measures to hopefully prevent precipitation of those crystalloids that are in the urine to begin with. So I'm happy to take any questions. I have offered you a photo of my very favorite coffee mug that I parade around with me on a regular basis, and just a couple of information slides here as well. Please feel free to contact our veterinary teaching hospital. We've got both a large animal clinic and a small animal clinic, and so our contact information is there. At least on the large animal side, we do offer emergency services 24/7, 365 days a year. We're always here for any primary or referral emergencies that you might have with your animals. And then certainly feel free to reach out and follow us at all of our various platforms for more fun information and first aid topics. With that, happy to answer any questions.
Several in the Q&A.
Okay.
Should be able to see on there.
Sure. Does anybody in the room? Yeah.
Oh, yeah, I just had a question on the ammonium chloride, given that, do you have a lot of renal issues following it or no?
Rumen issues?
Yeah, like the.
Yeah, so with the ammonium chloride, does giving or administering the ammonium chloride lead to any rumen issues? Typically not, if it's dosed appropriately. The issue that we have is because it's a salt that's given and then absorbed via the rumen and the GI tract, the components of that salt end up in their circulation. And so when I say that we make the whole animal acidic, we more make their bloodstream acidic. And so we can see some animals where the acid-base balance gets off because we've overdone or overdosed the ammonium chloride, or we've been on it for too long, or that sort of thing. Low doses for too long without ever taking them off also leads to, again, I kind of mentioned the kidneys learning. And so it sometimes does eventually stop acidifying the urine because the kidneys have created a new homeostasis where they figured out the salt balance in lieu of the fact that you're giving them that salt orally. So that's where that pulse dosing can be really, really helpful in preventing that from happening. But if it's dosed appropriately, the rumen tends to be fully capable of, the ruminal environment tends to be fully capable of handling that salt content. Yeah, great question. Anybody else in the room? Yeah.
So with the calcium crystals, are those prevented from forming with urine acidification as well as the phosphate ones? It's just once they're already formed, we can't break them down with urine acidification.
You got it. So the question is with the calcium-based stones, if the urine is acidified, do we help prevent those crystals from forming? Just the difference is that once they're already formed, the calcium carbonate ones won't dissolve back down, but the phosphatic ones will. That's absolutely correct. So both of those stone types, the components of both of those stone types will be floating around in the urine as little crystalloids. And if we re-acidify the urine, we can prevent them from forming into the stones and dissolve some of those crystalloid components. Once they form into the stones, the phosphatic ones are less stable. And so if we re-acidify the urine, we can get some of those to dissolve apart again and break down into their individual components so we can pass those along as we would normally. With the calcium carbonate ones, because of the various bonds that creates between all of those different elements, those are really, really stable stones. And so even though we can prevent them from forming in the acidic urine and we can start to prevent or dissolve the little crystalloid components, once they've formed into those stones, then we don't have a chance. And so you're absolutely right. The acidifying urine can be treatment for the phosphatics, but it's prevention only for the calcium ones. Once they're formed, we've got to go get them physically because nothing we do is going to break them down. Yeah. Great.
Should be able to scroll.
Okay. Hey. Yeah. Question here, at what age do we typically see blockage occurring? Any. It can happen in very young animals as well. I think the youngest one I've treated personally was 8 months old. But certainly, and that's where some of the literature suggests that after kind of that 4-month age range, we start seeing the calcium carbonate ones a little bit more often. The phosphatic stones are not necessarily correlated with any age, or there's not a higher risk of increasing age with the phosphatic stones. It could be any. Regarding diet, we still recommend avoiding feeds marketed for goats with urinary health in mind. So there's a Purina all life stages goat feed that advertises a balanced calcium phosphorus and contains ammonium chloride. So that particular product I don't have a lot of personal experience with. Certainly it's one measure that companies are taking to start addressing these things. They haven't been developed for long enough for us to know whether or not they're going to significantly decrease the instances of obstructive urolithiasis. These companies often do a lot of research. I'm not privy to that research, but it certainly is probably out there, at least from a proprietary standpoint. And so until we know really and truly that it is going to make a difference, my recommendation is still going to be to avoid the pelleted feed. The other consideration to that is that in feeding the pelleted feeds, whether it be hay pellets or the concentrate pellets, part of why we discourage that and encourage more of the forage and the grazing is the fact that the water intake is so much less. The required water intake and the drive to drink is so much less when they're fed any component of a pelleted diet. And so having them get their nutrients from the foraging, the grazing, will also encourage increased water consumption, which is a component of clearing out the urinary system. So while they may be a little bit more balanced and they've got this ammonium chloride, and I do also think that it stands to be known when they are constantly given that ammonium chloride. I've already alluded to the kidneys kind of learn how to balance out the acid-base status. And so if they're constantly exposed to the ammonium chloride through these specialized grains, eventually they're not going to respond to the ammonium chloride anymore because their system's going to essentially figure out how to stay balanced in light of it. And so that certainly would also be kind of a limiting factor to using those as well. Goat specific treats, okay. Again, I tend to just say no, because a lot of the grains that we've just talked about a more specific one here, but most of the commercially produced grains are what we are correlating with the development of these stones, and that includes the treats. And so even though they're goat specific, they're still predisposing that animal to having the dietary indiscretions that can cause these stone formations. Is orchard hay grass a good choice for primary feed? Yes, orchard tends to be one of the grass types that is a great choice. Timothy hay is another one, and valley grass hay is a third. That any of those tend to be well received by the goats and are not necessarily the legume family that are going to be higher in calcium and predispose them. So yes to that question. This note says vet recommend removing sheep specific mineral tub for our males. They easily cause formation of stones. Is there a way to get them trace minerals without mineral tubs? So there are some trace mineral products that can be fed just as like some people will just scatter them on the ground or scatter them on top of the hay. Again, working with your vet to determine what would be best for your specific situation would be the most appropriate to do, but there are several ways that you can do that without mineral tubs. They do make loose minerals and that sort of thing, and so working with your vet to determine how much and how frequently is most appropriate there. Another comment about goat feed with ammonium chloride. So my concern about that is that if goats are constantly fed ammonium chloride, they're going to get resistant to its effects, and it's not going to give us the preventative benefits that we're wanting to get with that urine acidification. So it seems very standard now. I would argue that it's not helping the situation. It's just making a whole bunch of goats that are resistant to the effects of ammonium chloride, unfortunately. Getting ammonium chloride into sheep without the use of grain, it makes it a bit more difficult. I'll have a lot of people mix the ammonium chloride with either water and like the tiniest bit of molasses, or with, and by tiniest bit I mean tiniest bit, just enough to take away a little bit of the salty flavor. Sometimes people add a tiny little bit of applesauce into the syringe and actually just syringe it into the animal. It does make the maintenance in that case a little bit higher. You have to physically kind of go do something. I would argue that if you have to use some sort of pelleted feed to get the ammonium chloride in, then I would tend to choose, and not have this be the basis for their diet, but would tend to choose a grass hay pellet to try and make that happen, because at least it's still grass hay. So like a timothy pellet or something like that. Fermented grass hay and increased risk for creating stones, and our corn husks higher risks. We'll only be adding for does and ewes next season. We partner with grocery stores to reduce the corn husk waste. So again, the corn husks are, if it's just the husks and not necessarily the corn itself, obviously. I don't know if we have specific data that correlates that particular feedstuff with being higher risk. The fermented grass hay, I think is less of a risk for creating stones and more of a risk for creating ruminal acidosis. And so I would be a little bit concerned about those sorts of feedstuffs. The other thing that we tend to see with any sort of fermented products is the potential for increased incidence of some of our bacterial pathogens. So listeriosis is one of them, botulism is another, and so those products have to be really, really, really carefully fed to any species that are getting them. The sheep is older, hasn't had any urinary problems yet. Are there any risks starting them on the ammonium chloride later in life? No. If dosed appropriately and in line with the recommendations made by your vet, there's no risk for starting that ammonium chloride later. It's just a matter of whether or not the animal already has stones, and whether or not they are going to dissolve in that acidic urine. But if the sheep has not had any problems before, and you're doing it more as a preventative measure, then there's nothing wrong with starting doing that later in his life. No. Is another symptom of blockage that the castrated male goat looks at or mouths at its penis when urinating, not making them constipated and hunch, or that might just be normal boy goat behavior. So if the animal is doing that while it's urinating and they're able to urinate a full stream, we're less concerned about them being actually blocked. Again, it doesn't mean that there's absolutely no stones in there, just that they're not actively experiencing an obstructive urolithiasis. When they actually properly become blocked, they will do more of that constipated hunch pose and the straining. And so what you're describing, if the animal is actually just properly urinating, it might just be a little bit of goat behavior that you're witnessing. Certainly when animals start dribbling urine as well, that can be a concern for the potential for a partial blockage or at least some degree of urethral irritation that's occurring. And so even though that you're seeing some urine come out, it doesn't necessarily mean that there's not an obstructive process going on. Any tips for goats living with blackberries? Do they absolutely need to be separated? For goats living with blackberries, I would just try and keep them mowed down as best as possible, and just have it be, the little bits here or there. We don't have as strong a correlation with the blackberry plants as we do with the, alfalfa plant and that sort of thing. But if they're living with blackberries, oftentimes what people will implement is just trying to keep those mowed down as much as possible. If they're already, or the goats have already mowed them down, they usually do a pretty good job of not letting them regrow. And so if they're not getting substantial amounts of it, then likely to not be as much of an issue. But if it's whole bushes and they've got access to a whole lot of it, then my at least personal recommendation certainly would be consider either taking care of those blackberry plants yourself or having them separated from the goats. Does molasses promote stone formation? Not necessarily something that we correlate specifically, but certainly not something we would ever want to overdo. And so like I said, tiny little bits of molasses may help with the ammonium chloride administration, mixing it with more water in a syringe, that sort of thing, but it's absolutely not something that I tend to recommend people give a lot of. Not necessarily just from the stone formation, but from the carbohydrate standpoint as well. Any animal that ferments, that gets a lot of carbohydrates, certainly can have trouble with breaking down those carbohydrates and fermenting them in their rumen, and we can have other problems that we see secondary to that. And then a comment about having pet goats and giving them crackers as treats, and that being bad. And so I recognize that it is so much fun to do that, and this is where it's always a little bit heartbreaking to tell people, but no, I would not recommend giving crackers or human food as treats for goats. Not only just from the standpoint of stone formation, but just their ruminal health in general, and there are other things that we can see develop secondary to them getting a lot of processed foods or treats or again human treats. They love them, and I know it's so much fun to give it to them. But definitely not something that we wanna promote, unfortunately. So things like vegetables, fruits on small bases, plant-based treats are all really, really great options to give them. And avoiding the processed things and the grains such as crackers is better off. I think that's all the questions we had in the chat. Is there, yes?
What is it about the blackberries that causes the issue? Are they high in calcium, kind of like alfalfa is, or?
Yeah, so it's the balance of the calcium to phosphorus and magnesium in those plants. And so and the fact that they're so proliferative that consuming a lot of them it's the same kind of general understanding as like with the alfalfa would be. And so, yeah, it has to do with the fact that those plants are the ratios of calcium and phosphorus to magnesium in those plants will support the formation of stones if that's a significant enough component to their diet.
Is there something that you could feed them along with the blackberries that would kind of help balance it out, like black oil sunflower seeds or anything like that?
Not that I'm aware of specifically. The question was, is there anything that you could feed to balance out the blackberry plant? And there's nothing specific that that I know of for the blackberry plant specifically, other than just not having them consume that plant in really high quantities. If they do have exposure to that plant, then certainly making sure that some of these other preventative measures are in place would be really prudent. So increasing the water intake, doing the ammonium chloride, making sure that the rest of their diet really is, grain-free and grass hay based only, that they're allowed to kind of forage on pasture grasses and that sort of thing, will all help mitigate then the potential kind of dietary indiscretion of the blackberry plants. So I think not necessarily something directly to oppose the blackberries, but all of the other preventative things will help the blackberry risk be mitigated. If that makes sense. Yeah.
Feeding like baled hay, if I was on like a mix that is mostly orchard with a little bit of alfalfa in it, can you feed something like that with like one with some like black oil sunflower seeds or something offset it?
Yeah, there's really no way to avoid the question was if you've got baled hay that might have, it's mostly grassy but might have a little bit of alfalfa, is there any way to feed that with other things to mitigate that? And again, there's really no way to prevent the consumption of that increased calcium with that alfalfa. And so it may be a situation where working with either your veterinarian or extension specialist to be analyzing the hay and determining, okay, what levels of all of these elements of the calcium and phosphorus and the magnesium and the potassium, what levels of that do we have in this particular hay, and what might we need to address in order to again kind of take that the DCAD or that cation anion difference. We know that taking that down to zero by balancing out their diet, and it would be very specific to the type of hay, even the harvest of hay. And so that gets into a lot of really high maintenance analysis stuff, but it can be done. Where you start looking at the, really the fine structure of that forage, and then determining, okay, how do we get our cation anion balance down to zero? Because we know that that is one of the best strategies for making their urine pH not so alkaline, keeping it in a more of an acidic range, where then hopefully those stone precipitors or precipitates would prevent from being able to actually form the stones. And so long answer to your question, short answer would be working with dietary analysis. With your vet, with again extension specialists are really good at doing this, and having those analyses in place can really help you determine, okay, is this ratio that we have of calcium to phosphorus in their overall total diet appropriate, or do we have to do something to manipulate that to keep that ratio where we want that kind of 2-to-1 range. So it is possible, it's just a little bit of work.
Yeah, what kind of things do you tend to add to the diet to kind of balance some of that out? Is bivalve sunflower seed one of the things that can be used to feed along with the aids, or is there other things that?
Yeah, so can black oil sunflower seed be or oil be used to kind of add in some of those elements? And again, I think there are a lot of different formulations of that oil. It's not a kind of a one creation as everything, right? It's not all created the same, and so utilizing like that product is really commonly utilized as a dietary supplement. But having an analysis of it is really kind of the starting point to know whether or not it's gonna make a significant difference in balancing out that dietary ratio, or if you might have to look towards a different product, even that same sort of oil, but maybe just a little bit of a different formulation or that sort of thing. Yeah.